So it's great to see everyone. We're going to do spend a lot of time in conversation today and in breakout rooms. But before that, we'll do our regular welcome, and please go ahead and introduce yourself in chat. And in honor of an event I'm doing this afternoon on transportation, I'm going to ask you to do the same thing I'm going to ask everyone to do this afternoon, which is to put in your name and your organization and your favorite fictional method of transportation. So see if it works. Your favorite fictional method of transportation. Which brings me to, briefly, I want to just tell you about a couple of Thrive events coming up. So Kirsten's going to share screen this afternoon. Safer streets and public transit fleets. We're going to be talking about the future of transportation in San Mateo County. We have representatives from Samtrans, from Caltrain, from Peninsula Clean Energy to talk about EV charging, Silicon Valley Bicycle Coalition, Rise South San Francisco to talk about how all of this affects equity and serving our most vulnerable populations, and kind of the future of transportation. So you're all welcome to come to that. And because of the feedback from this group, we are continuing our stress management Wellness Wednesdays. And so the next one is March 9th, and the focus is going to be on specifically on different methods you can use to help with stress. So again, and then our next Voter Education and Outreach Advisory Committee, we're going to have a special guest from Youth Leadership Institute to talk about how they do outreach to youth around voting. So that's what we have coming up. I want to remind everyone that Thrive does a lot of things to support the nonprofit community. And if you're not on our mailing lists, we have a weekly mailing list that talks about all of the different events we do, as well as community announcements, like when grant opportunities come up. And we also have mailing lists specifically for different subject areas. So if you're interested specifically in children and education, specifically in environment and sustainability, or if you're an HR professional or any of those things, you can check that off and make sure you get targeted emails when we're doing an event that's relevant to you. So I haven't looked at the chat, so I hope everybody had really good fictional methods of transportation. Oh yeah, Hogwarts Express. I wasn't even thinking about that. I was more thinking Jetsons, but yeah. So thank you so much for that. With that, I'm going to hand it over to Helen, who's going to give a couple of updates, and then we're going to break out into groups to really talk about what the stress points are right now. I know there's been a big change with the lifting of the mask mandate and the subtleties of, yes, the mask mandate is lifted here, but you still have to wear it in public transportation. You still have to wear it in schools. So there's a lot of communication around that I think we can talk about. And hopefully everybody's feeling a little bit like we're seeing a light at the end of the tunnel. So again, thank you all for being here. We will be dividing up into groups after Helen's updates.
Thanks, Petra. And I love the question. That's so fun. But yeah, I just have a quick update I wanted to share. Thank you to everyone. Office of Community Affairs recently has created a new set of graphics, 4 graphics. And I think for those of you who took the survey, you all were able to see them. They were also presented at the Vaccine Equity Working Group last week as well. So we created new graphics on masking, recommendations on opening windows, the COVID testing timeline, and then also isolation guidance. So our survey to collect feedback closed yesterday at noon, but thank you to everyone who provided feedback. We got some really great suggestions and edits. So I just wanted to let everyone know that our team is working on updating those graphics, and we're hoping to turn them around by next week's communications calendar. So the calendar that goes out every Monday. So just wanted to say thank you. We're really excited that we got 13 responses in just like one full business day, because that survey went out Friday at like 4 p.m. and was so happy to see that people were like really engaged. And really, that's it. So I'm looking forward to hearing what people have to say in the breakout groups, because that can really help us in guiding like information and guidance that's coming out of the county. I'll turn it back over to Petra.
So we're going to do 4 breakout rooms, and we forgot actually to introduce, I think most of you know Kirsten, my colleague from Thrive Alliance, is going to be doing one of the breakout rooms. And Josh, do you want to introduce yourself?
Yes. So hi, my name is Joshua. I work with Helen at the Office of Community Affairs. I'm an outreach coordinator, and I'll be facilitating one of the breakout rooms there.
So we'll divide the breakout rooms. Kirsten will divide the breakout rooms, but you can self-select as to which breakout room you want to do. We heard from you that you wanted to do it by geography. So you can pick, and Kirsten, I'll hand it to you for that. I'm going to take advantage of the fact that I was in one of the breakout rooms and go with the very last comment that we had, which was that Peter was saying that some of their families have been very accustomed to getting, specifically he's referring to food aid, but just in general, that some of the things that were kind of emergency aid is stopping, and that a lot of the families are worried about that. And I want to let you know on behalf of Thrive that there's plenty of food, and we can figure out other ways to get food to you. Samaritan House has said that there is plenty, so we don't have to worry about that. If we can make some kind of a connection for you to make sure, if you're hearing from your if something is ending and you need more food aid, we can figure out a way. You can reach out to us, or you can reach out directly to Samaritan House to make sure that that happens, because we really know that, you know, it's not just, you know, there's COVID, but there's also a lot of inflation right now. So like the effects of COVID, the people, you know, losing their livelihood for either permanently or for a period of time, you know, those are all issues. But then even for people who haven't been affected, who have, you know, who are working, and things are just more expensive. So there is sufficient food all over. So
amazing. Thank you. We will definitely touch base. I really appreciate you bringing that back in here.
Yeah. And if there are other things, Ellen, I was wondering if you could address this, something else that came up, which is that families that are having to take unpaid leave because of COVID, I know there are resources and laws and stuff. Maybe you could address that a little bit so that everybody has access to the same information.
You're asking me, Petra? Yeah. Well, I'm not up to date on that information. I would have to ask our departments on that. But I can take that down, and I can do some digging on the county website right now just to look around and see if I can find something. But the question was about unpaid leave and what resources are available for that. Did I hear that right?
Yeah, because I think in California, yeah, if you're taking leave because you have COVID, you're supposed to get sick leave for that. So we just need to make sure that everyone has the correct information.
They call it the COVID leave. It's a COVID leave. It's not a sick leave, but it's a COVID leave. Yes.
COVID leave.
Yeah. So you know, the employee has to be paid. Yeah.
Yeah, I believe it was extended. It was originally coming to a close, but I believe it was extended. I just couldn't. I'm looking right now for the actual. I'm not sure if it's actual legislation or something that was pushed through, but I believe it was extended, and specifically because teachers with Omicron were really suffering. So there's a large movement there because they had to stay home, and it was just running rapid. But I'll keep looking. But I know there's something. I remember seeing something.
We'll make sure if we don't get that by the end of this meeting that we follow up, because all of you should have access to that. So if somebody is saying, hey, you know, I took off time and I'm suffering for it financially, that, you know, that the employers are responsible. The hard part is when people are employed a little less officially. That's definitely something that there isn't quite as clear of an answer. But if you're officially employed, there are resources.
And I just looked at the state website, and it sounds like the 2022 COVID-19 supplemental paid sick leave went into effect as of February 19th. So very recent. But yeah, I just put in the link. I still have to read up on it myself, but that's the link I found at least.
Yeah, I found something too, Helen, and I wanted to add, because I remember hearing this, don't quote me on it, but I feel like even though it was enacted and effective on February 19th, because January 1, 2022 is the start date, from what I learned, it can be retroactive. So excuse me, it's worth us looking into that process for those that have already suffered, income loss in that time period.
Yes, you're absolutely correct. I'm saying that it's retroactive to January 1st.
So that would be worth maybe doing a big social media push about, so that people know what their rights are. Okay.
Helen, did you give a link? If so, could you give that link again to the information that you found?
Yeah, of course. I can put it in the chat box again.
Thanks.
And we'll make sure Kirsten will send it out in the follow-up email, because not everyone's here, but we really appreciate those of you who are here, because this is when we find out these kinds of gaps in information that are useful. So we'll definitely be talking about the food and that. And I'm going to just share this because I thought this was very funny. One of the things that came up that not funny is that people need help reading the antigen tests. And when I looked at that, the first thing I thought was, oh, that looks like a pregnancy test. But the young generation, they're going to look at pregnancy tests and say, oh, that looks like a COVID test. Backwards. Anyway, I just found that amusing. But we did hear in our group that there actually has needed to be some communication around how to read those tests. Alexa was telling us that. So I think that's also something to keep in mind, that even though it looks relatively straightforward, it's not necessarily always that straightforward to some people as to how to read those tests. So sorry, I just shared a lot about what happened in our group. Would love to hear from people in the other groups how it went. Oh, accessing tests. So have people been talking about getting the ones from the federal government? Like how to do that? Because it's...
Well, I think that's the issue, because we're assuming that folks have access to computers and are computer literate to get those tests.
Okay.
So I think that's a barrier. And as well as, if you have a very large family, you only get 2 kids. So we did ask Joshua in our breakout session to find out, is the county going to release any of the supply that they have? I know we're going to be getting some from the state, and, as a CBO, and I think others are going to be getting some as well. But just overall, it's sort of an overall strategy, or at least being able to help people fill out the form online, because we're assuming they can do that.
Yes, it's, our community members too have been asking. For those who have already received the kits, they're asking whether they could still order some or request some more some more kits, because the four kits was not sufficient for some of the families, because family households may compose 7, 8, 9, 10. So we have to advise those who were not able to use the 4 kits to buy to buy some at the pharmacy. So but the question is, will there be other supply? I mean, following supplies that will follow after the 4 kits. So
Helen, do you know if the county has extra ones available to distribute to CBOs?
I know we were distributing them via sites for food distributions and such, but I also thought that the COVID tests from the federal government, I thought I saw something that they were per month. Is that not correct? Did I just make that up?
some clients have ordered again, and then they said that you have already ordered, you have already received your your kits. So
Okay. Okay.
I
So
think,
don't quote me on
Helen,
that.
I don't
Mhm.
think you're too far off. I believe that the ones that were through your insurance that you were allotted, those were monthly.
Oh, I see.
And then the
Okay.
one from the government was one-time deal, from what I understand.
Okay. So it's through your insurance if you have an insurer. Okay.
Yeah. And I had a question also about resources for businesses for PPE. I know that, I mean, in the beginning there were PPE grants and whatnot, and if they already got one of our vendors who also is a brick and mortar, Roslyn Bakery, I was talking to him and he has been providing KN95s for all of it. He has 30 employees and he's providing them with KN95s as well as testing once a week. And it's gotten very costly for him. And he feels like it's the right thing to do for his customers, his family, and his employees. That's the question, if there's any other PPE assistance available, if you've already received one in the beginning of COVID.
So I know our mask mobile is still going out, so we still have a weekly schedule that's for masks. And I know Joshua is he's in charge of that. But we also, the county is still also giving out PPE, like for CBOs who want to pick up like a large order of those. So that's still available. I'm going to look up that email address. You have to email, there's like a specific county email, but they also have PPE available.
If it's the county email for the overage that they had at the event center,
yes,
that they do not have tests. They have, because I emailed them right away and they do not have masks or tests. And those are primarily what he needs. They have gowns and face shields and yeah, they have different supplies than what the general public would need.
Okay.
But thank you. And if anybody knows of anything, please email me. I'll pass the information on to the small businesses.
Okay, yeah, I'll keep that in mind if I see anything. And then I know that our county was distributing at-home tests through WIC sites and through some schools. But I think that was, supply was limited and that just kind of depends. So I'm not sure where they're at on that anymore.
Alexa?
Oh, yes. I also just wanted to mention this. I think I briefly mentioned it last time, but we over at Ravenswood Family Health Network, we have tests, antigen tests available for pickup at our vaccine clinics. And people can pick up 1 kit per member of household, up to 5 kits, and each kit has 2 tests, right? So that's 10 for each household per week. And so I know it might be an access issue in terms of transportation because it's at our East Palo Alto clinic and then our other sites in Santa Clara County. But I just wanted to put that out there. That's for all patients and community members. So please feel free to publicize that and use that as a resource.
Do you have a flyer or something that we could distribute that you could send to Kirsten?
I don't believe we have a flyer, but I can work on making one and work with our vaccine clinic team on that and send it to you.
Or even just a little blurb that we can put in our news. It'll only go out to the CCATs people, but.
Yes, can definitely write a blurb. If you want a flyer, it might take a day or 2 more, but I can get that too.
I think a blurb is fine.
Okay.
Do you guys need a flyer? Anybody want a flyer? Okay.
Okay, I can get that to you later today because definitely want to increase access to those tests.
Thanks. I think that'll be well appreciated.
Now, when you ask Petra if anyone wants a flyer, are you offering a flyer with what the availability of the tests for pickup?
Yeah, from Ravenswood.
Would you be emailing the flyer, Alexa?
Yes, I can send it out to this email list, or would it be easier to just email it to you two, Petra and Helen, and then you send it out?
If you may email it to us, then we can send it out to the wider email list.
Okay, that
Thank
sounds good.
So it sounds like there is desire for a flyer. Thank you. Colleen has a question probably for Helen and Joshua.
Do you want to take that one, Joshua? I think she's asking about any children's KN95s.
So right now for the K9, so for children's, we only have cloth masks for youth. But for K95s, unfortunately, we only have the adult size ones. But I'll definitely look into it. I'll ask one of my supervisors if we do have some in stock.
Thank you. Also, can I have some of those youth cloth masks?
Yeah, I think I'm not sure if you spoke to Kenny yet. I think we were planning to join you in the farmers market. I forget. Yeah.
One of the spots, there's a couple spots I gave them information for.
Yeah.
But great. Let me know if you need any help, assistance contacting any of the market managers.
Sounds good. Thank you, Colleen.
Yeah, what we have been doing with the school children is that, not many, but some school children is that if they don't have masks, we give them the adult mask, but we have to fold it, and then, adjust the what do you call that one? The string, so it fits them, but the mask has to go all the way up to the, and then we have to fold it on both sides so that it fits them. So it's a for it's just like a, a first aid thing, if they don't have the mask. So especially when we go around and then they will say, oh, do you have masks? And say, oh yeah, I have one for adult, but you can adjust it, we can do it, we can do the folding.
So I'm actually planning for next month's Maskmobile efforts. So if you guys want us to join you in any of your efforts or have a specific place that needs mask, we can definitely do a drop off as well. Just keep me updated. I put my email in the chat. If anything, you can also message Helen, and Helen can relay the message to me, and I can definitely add you to next month's efforts. So yeah.
Great. Sorry, I just started talking, so we didn't get to each area. So does somebody from the North County want to tell us what came out of their conversations?
I can talk because I took the notes. But if anybody from my room wants to jump in, if I missed anything, please feel free. I think, and now I have to look at my notes, but there were a lot of questions. We talked more about what kind of questions have been coming up in the community and what questions have been a little more challenging to answer. And so I think there's been some questions on when should I get tested, but last month's meeting was really helpful in answering that. And then questions on which vaccines are most effective and what the latest recommendations are on that, and especially for each age group and whether that differs. And then also there's still been some questions on registration assistance for testing sites. With the recent mask mandate, there's been a lot of questions on that, and my group members share that there's also been some confusion because in the community and some feedback where because CBOs and our Maskmobile, we're still giving out masks, there's been some confusion why are you giving us masks when the mask mandate has been dropped? And some more education around that has been needed, that even though the indoor mask mandate has been dropped, it's still important to mask when you can, because it's, you know, good. It's good for extra safety and for protecting those around you. And I know I'm probably missing some, but I think it's a good start. And if I think of anything, I can also jump in later.
And coastside. Oh, sorry, Adam's got something to add.
I was just in North County too. Thanks, Alan. That was really great. I just wanted to mention we'll have a graphic that we're producing, but at the library in South City, we now have a group of librarians trained to help answer a lot of these questions. And so maybe even like came up today, the free federal COVID test kits and making sure people who don't have computers can get some, so we can help with that. Obviously, if people are like symptomatic and looking for testing, we want to help them over the phone. So we have, you know, text, phone, and email assistance, as well as in-person assistance to offer. And so we'll send Helen the new graphic for that, and we'll make sure that gets around.
Thanks, Adam. That sounds great. And I think as a library, it's a great place to help with the access issue. Coastside.
It's hard to tell.
I can fill in because I did the note taking as well. And then again, if anyone from our group has anything to add, feel free to jump in. I think to echo a lot of what Helen said about masks, there's a lot of confusion about the mask mandate and why masks are still being distributed despite the mandate being dropped. Also heard that some inventory is not moving because when tests and masks started to become more prevalent and available, that's when the inventory was kind of stocked. So one thing that came out of that was that expiration dates might need to be checked to make sure that none of the materials are expiring. And then in terms of seniors specifically on the coast, sounds like outreach is going pretty well, but there are just concerns and questions about the variant and if it's sort of safe to go out. It sounds like there's just confusion all around about that, especially with the mask mandate being lifted. And then I also heard that there is a need for more materials translated into Chinese and Spanish specifically. And that, you know, with the mask mandate being lifted, I think particularly the senior population, but folks in general might feel a little bit more vulnerable and sort of afraid to go out. And right now, the key seems to be providing the right information and kind of what feels like this in-between state where there's a lot of confusion. We kind of don't know what's going to happen next. And there's a lot of frustration about, you know, not knowing exactly what's going on now. And then Colleen had a great recommendation for a graphic as well about sort of illustrating the variance by size and having another element of the graphic be related to like cloth masks and just something to sort of illustrate why cloth masks might be less effective for certain variants and why KN95 masks are being pushed a little bit more. And there's just generally a lot of distrust, misinformation, miscommunication about masks in general. I think a lot of it is stemming from the mandate and what kind of masks are being pushed right now. And then one last thing is, it sounds like there's a little bit of difficulty with coordinating efforts about where to distribute Spanish communications in particular on the coast. So if there's anyone on this call, and I'll do a little bit more digging as well to see which of our partners might be able to help out with this, but if there's anyone on the call now who has ideas or recommendations for who to get connected to distribute Spanish materials that are ready to go, just don't know, you know, which pockets are targetable and don't have enough feet on the ground to be able to do that as well.
Yeah, let me give a little more context to that too. That was a very good synopsis, Kristen. Thank you. So we have, this is Casey from Senior Co-Siders, and we've been approached a couple times by a community member who is sort of acting like a single volunteer trying to get COVID related information to the Spanish speaking community. And she's really focused more on youth, I think, and families. And at Senior Co-Sider, our Senior Co-Siders, we're really covering sort of the older adult community, all ages on the coast, but not so much in Spanish. You know, our primary language is English. So she's been trying, she's kind of been struggling to find a resource where she can, you know, make up to 200 copies of these flyers. She's okay getting them to the right places, but she's running into some roadblocks figuring out who she could best partner with. So I wanted to ask that question of this group: is there an organization that services primarily Spanish-speaking community in the Central Coast that she could hook up with for a little bit more support? I mean, in the meantime, I'm happy to run copies for her that she can distribute. Like I can do that. But in terms of hooking up and making sure that she's having the biggest impact, that I'm not really sure about.
Helen, neither ALAS nor is Coastside Hope funded? I don't think they are.
No, I don't think so.
No.
Puente is, but Puente is really far south.
Yeah, I would see if she would want to reach out to either ALAS or to Coastside Hope.
She reached out to both of them.
Okay.
And the response she got is that they don't have the resources necessarily to do what, you know, to get the material ready. And it seems as though they're doing everything they can just to get like Alice is really focusing on distributing food. And so I didn't know if there was anybody else that she could reach out to.
If you want to, we
And
can
maybe
have this. Let's have this conversation offline, and let me see if I can think of other people to connect to. But we're running off on time, and I want to have just 1 minute for the mid peninsula,
Mid-county.
mid county. Thank you, mid something.
Yeah, I mean, just to echo what Helen and Kristen has already mentioned, the number one issue that they've been having is the lack of consistent messaging or simplified messaging due to the changes in mask mandates. And also, we also need translations, more translations in Tongan and Samoan, and also in Arabic, as well as a change in Chinese translations, because right now we're doing simplified Chinese rather than traditional Chinese. And from what I've heard from Phil, a good chunk of the population that they're serving speaks traditional Chinese rather than simplified Chinese. So that's pretty much it. If Lisa or Phil or Sala wants to add anything, please do so.
You did a great job, Joshua.
Very simple. It's very concise, but only had a minute, so.
So, so I feel like we have a whole bunch of things to follow up on and get out to you regarding testing, food resources, the information around employment, COVID sick leave, anything we know about kids masks, help reading antigen tests, the information from Ravenswood about getting more testing, getting more test kits. So look forward to a nice long email from Helen and Kirsten with all of that information, hopefully all together. Actually, maybe it'll probably be our all together with the end of the month email, and then that way you'll have it all in one place. But this was super helpful to us to know what's really going on so that we can address as much as possible. And I want to do a shout out to Helen and the Office of Community Affairs, because I heard many times what great materials and how appreciative everyone is for the work you guys do. So definitely thank you for that. And that way we all leave on a positive note, and we will see you all next time.